Good morning, ma'am. Good morning, classmate. The topic is all about the dairy herd replacement. Introduction. Sabi ni Andrews in 1971, ang average of length of time sa pagmilking herd nasa 3 to 3.5 years. In 2006 naman, 2 to 2.5 years kay Castle. Naobserbahan na ang productive lives ng Holstein in 24.6 months, samantala kay Jersey, 29.5 months. Isa sa pagbaba nito ay dahil sa economic pressure, ang pagkal ng older cow para magkaroon ng available room para sa younger heifer. So, may dalawang objective which is to determine the different methods of dairy herd replacement and to discuss the diseases that may affect the health and well-being. The discussion. The needs for dairy herd replacements. A dairy producer needs annually to maintain herd size, independent largely upon herd management, animal health, reproductive efficiency, and culling pressure applied to lower producing cow. Ang major reasons ng culling ng cow ay dahil sa may 27.4% na na-injury, ang sa poor reproduction naman ay 19.5%. Sa mastitis or other naman ay 16.2%. Sa low production naman ay 12.8%, samantala naman ang sa sold for dairy purposes ay nasa 8.3%. Ang sa feet or legs ay mayroon 3.6% and sa diseases with the average of 2.8%. So, ang overall average ay tumaas mula 25% in 1971 to 35%. A dairy must raise off all its female calves to maintain a 110 cow size, assuming a 50-50 sex ratio and average mortality of 18% up to calving age. National Animal Health Monitoring System in 2007. Pre-Martins, the female twins is protected against the masculinizing effects from the male because their placentas contain an enzyme capable of converting androgens to estrogens. This enzyme is apparently absent in the bovine placentas. Diagnose ng pre-Martins ay base sa clinical examination pero pwede ring ma-determine from sex chromatin test at blood typing and skin grafts. Ang high tolerance ng skin graft ay mula sa male twins. Ang gestation period ng twins ay usually 3 to 10 days, shorter compared to single calves. So, determining the best method of replacement. There are 4 best method of replacement. So, una dito yung raising dairy herd replacements. The most dairy managers raise their own heifers for a variety of reasons. Include, it is more direct control over a progressive breeding program, usually lower cost, maximal use of available feed, labor, and facilities, greater biosecurity against diseases brought in from outside the dairy, and potential additional income from heifer sales. Pero may mga disadvantage rin ito, including the lack of return on investment for 2 years and substantial feed, labor, land, housing, and managerial time diverted from an immediate source of income. The production of milk, additional lactating cows, in lieu of the heifers, would return greater immediate profits. The second method of replacement is the purchasing dairy herd replacement, na kung saan ang mga milk producer ay gusto talagang mag-expand ng herd size para makapurchase ng dairy heifer. May mga limitasyon naman sa pagbili ng herd replacement. So una, milk production information is usually inadequate, especially when purchases are made from cattle brokers. So may mga production potential ng heifer ay mahirap i-evaluate kapag ang production data ng Sire and Dam ay hindi available. Second, many heifer available for purchasing are of low or mediocre producing ability. It is not logical na ang mga owner ay mamimaintain ang best heifer as a replacement sa kanilang own herd. Third is cost of purchased replacements are generally greater than cost of those raised. And the last one is the disease is more likely to be introduced into the herd. So the next one, the contrast raising of dairy heifer. So ang alternative to purchasing replacement ay meron nang nagre-raise ng iba under contract. So may two general type ang contract, which is the sale purchase contract and direct contract. The sale purchase contract, which calves are sold to the raiser with an option to purchase when replacement status is reached. Samantala ang direct contract, which ownership of heifers is retained and the raiser is paid an agreed amount for growing them. And the last one is leasing dairy cows. So leases may be based on charge just per month, per lactation, per year, or so pound of milk produced. So contribution of colostrum of calves. The colostrum is the first milk secreted at parturition. First one is a provider of antibodies to newborn calves. Since neonatal calves are unable to produce antibodies for some times after birth, they must acquire perform antibodies through colostrum, which is especially high in immunoglobulism. The second is the pathogen found in colostrum. The three major sources of bacteria in colostrum are those shed from soiled udders, contaminated equipment, including buckets and bottles used in feeding, and bacterial proliferation in improperly stored colostrum. And the third one is colostrum globulin, serum protein, and mortality. The two tests can be made of calves' blood to indicate how cell cholesterol antibodies are absorbed. The most conclusive is an LGG assay, but it is expensive and time-consuming to deliver to a laboratory for assay. The target minimum is 10 milligram or milliliter of IgG is closely related to calf mortality. Antibodies of LGG have multiple functions including opsonization of pathogens to enhance phagocytosis, completely fixation for lysis of pathogens, prevention of adhesion of pathogens to tissues, inhibitions of microbial metabolism by blocking enzyme agglutination of bacteria, and neutralization of toxins and viruses. The alternatives to fresh milk for calves. So there are two alternatives to fresh milk for calves. The first one is milk replacer, a formulated feed designed to replace mother's milk in providing the nutritional needs of neonatal mammals during the critical early suckling or milk feeding stage of life. The milk replacer include hair byproduct. There are the ingredients which is commonly used in formulating milk replacers, including the dried skim milk, dry whey, dry whey proteins, plant proteins, animal proteins, and blood serum proteins. The second is milk enhancer, adding direct feed microbes, also called probiotics, to milk or milk replacer may support calf intestinal integrity and overall health. The important function of these bacteria are ferment carbohydrates, thereby producing short-chain fatty acid, including acetic, lactic, and butyric acid, that reduce intestinal pH and inhibit growth by some pathogens while improving digestion and absorption. Second, compete agents pathogens for nutrients and promote development and maintenance of the immune system, both structure and function, by signaling it to produce immunoglobulin and other health enhancer. The most direct feed microbial products utilize one or more of the following bacteria. The first one is Lactobacillus. Second is Bacillus. The third, Bifidobacterium. And the last one is Enterococcus faecium. The early weaning and one-a-day feeding. The first one is early weaning. The milk producer have reduced the cost of feed required to raise herd replacements by weaning at 5 to 6 weeks of age, although the national average is 8 weeks. The second is calf starter, is the dry feed that is fed when calves are shifted from liquid feed. A desirable calf starter in higher in energy, about 75% total digestible nutrients, or 1.5 mcal or lb of metabolicable energy, and contains 16 to 18% protein. And the last one is the automated calf feeding. The most calf feeders have 2 nipples per group of about 25 calves. Their feeders are programmable to allow for increasing daily feeding of milk replacer and decreasing milk replacer feeding during the weaning transition period. So, first, breeding of dairy heifers. When to breed heifers encompasses many considerations. There include the age, body size, and weight, seasonal milk price, milk yield, longevity, calving difficult, reproductive efficiency, and even showing competition. The first one is age. Age is the first service is less important than level nutrition, body size and development, and nutrition and physical health and well-being. When nutrition is optimal, dairy calves grow most rapidly between 3 and 9 months of age. The second is genetic factors, the body size and weight, and calving difficulty. The body size and weight in early breeding of dairy heifers should not retard grow post-breeding because pregnancy is not nearly as much a nutrient drain as lactation. Early breed high producing animals usually attain normal size after gestation. 11% more weight and 2% more wider height during their first lactation. They will reach mature size in their third to fourth lactation. In genetic and mature body weight are known for a herd population targeting no rates and breeding heifer at a percentage of this mature body weight at 60% has been proposed. Body size and weight and sexual maturity are closely related to plane of nutrition. In this calving difficulty, in general, as age of at first calving increase calving difficulty decreases. This is often confounded, however, by inadequate nutrition. And the last one is economic factors, include the milk yield, productive longevity, reproductive efficiency, seasonal milk pricing, and exhibition of dairy animals. The diseases of calves, my-infectious diseases and non-infectious diseases. Sa infectious diseases include the calf scars. The second is salmonellosis. The third is hemorrhagic enterotoxemia. The fourth, viral pneumonia. The fifth, navel 3 or joint 3. The sixth is Clostridium perfringens. 7. The sixth is Clostridium perfringens type D exterotoxemia. The 7 is viral diarrhea. The 8 is blackleg or black water. The 9 is infectious bovine phenotarchitis. And the last one is screwworm infection. Sa non-infectious diseases, include the poisoning by pesticide in several chlorinated hydrocarbons, linade and toxaphene, and organic phosphorus compound, chloral and nalaton. The second one is lead poisoning. It caused significant losses of young dairy calves. And the last one is arsenic poisoning. Acute poisoning is characterized by evidence of pain, staggering, salivation, weakness, diarrhea, collapse, and death. The dehorning and removing extra teeth. To reduce the incidence of future injuries, most dairy calves in the United States are dehorned. The application of caustic fascia or use of an electric cauterizer is prepared for destroying horn buds at 3 to 7 days of age. Although not usually harmful, extra teeth have no value and detract from the appearance of the udder. Therefore, 1% they should be removed when the calf is about 1 month old. The teeth and surrounding area of the udder should be disinfected with iodine before and after teeth removal, which simply entails cutting off the unwanted teeth close to the udder with a pair of sharp, sterile scissors. Usually, there is minimal bleeding, and it is sufficient to hold cotton wool to the site momentarily. So, the dehorning is a practice that is done on dairy farm to present injury to the animals itself, other herd mates, as well as the people that work with the animals. The calf dehorning is a routine husbandry practices on dairy farms that is justified by safety, reason for stock persons, and by a reduced risk of injuries among handmaids. So, the removing extra teeth, these extra teeth can be unsightly, may pose a problem as a site for a other infection, and may interfere with the function of the milking machine. The extra teeth should be removed as soon as they can be positively identified. Summary is to determine the different methods of dairy herd replacement, the diseases that affect the health and well-being, contribution of colostrum to calves, the alternatives to fresh milk for calves, the early weaning and one-a-day feeding, and the first breeding of their heifer, the diseases of calves and dehorning and removal extra teeth. An important aspect of a profitable dairy farm enterprises is having available a dependable supply of herd replacements of milk of high milk producing potential. So the dairy herd improvement is positive only when cows are placed with well-bred, well-fed, and well-managed replacement. So the importance of colostrum is sustaining the health of neonatal calves is well established. Colostrum is the means by which the cow transmits passive immunity, preform antibodies to the calf. Thus, colostral immunity significantly diseases losses of calves. Other excellent management practices for the maximal protection against diseases. Calves must receive colostrum soon after birth. In colostrum management, the dairy producers have known the importance of feeding colostrum for a long time. However, the quality, quantity, cleanliness, and timing of colostrum is critical for the best results. The calves need at least 4 quarts of high quality colostrum within 6 hours of birth. The colostrum quality can be measured by using either a colostrometer or a Brix ref- refractometer. The high-quality colostrum can also be frozen and saved to feed other newborn calves since colostrum quality varied from cow to cow. The colostrum quality can vary depending on several factors, such as age of cow and length of the dry period. One way dairy producer can minimize colostrum quality is by harvesting the colostrum as soon after calving as possible, because the amount of immunoglobulins in the colostrum decrease over time. Not pulling colostrum, taking colostrum from multiple fresh cow and feeding the mix the multiple calves. And also very important, so the high quality colostrum. The colostrum management is the first step in giving heifer the best positive start and avoiding pitfall later in the heifer program. So the dairy herd replacement. When raising replacement, heifer mini management practices during rearing can impact the growth, production, and probability of heifers. when she enters and completes her first lactation. And that's all. Thank you.